It's Friday, April 3. This is the news on PBCJ. I am Simone Absalom. Jamaica now has 47 positive cases for the coronavirus disease COVID-19. PBCJ understands that at least 3 of the 6 people who tested positive for COVID-19 in Corn Peace Settlement, Clarendon, are relatives of the 79-year-old man who was the first patient to succumb to the disease in the country. In a release on Thursday, the Health Ministry advised of 3 new positive results of COVID-19, which pushed the confirmed cases to 47. The 3 latest cases are a couple, a 79-year-old woman and a 73-year-old man with a travel history to New York in the United States. There's also a 32-year-old man from Portland with no travel history. Contact tracing is being done to ascertain the point of infections. Kingston's Andrews Memorial Hospital is to be used as an extension of the Kingston Public Hospital, KPH, as part of the government's efforts to shore up the public health system to deal with the coronavirus pandemic. Minister of Health and Wellness, Dr. Christopher Tufton, says the ministry had met with the owners of the hospital and an agreement was reached for it to act as an extension of the KPH, as the public hospital would be needed to deal with COVID-19 cases.
The permanent secretary and his team, based on discussions we had, have engaged the Andrews management in a conversation on the basis that we really need all hands on deck. We need to engage all, and if you're a hospital, there's a role for you as we try to overcome this challenge. And I'm happy to announce that coming out of those discussions, the Andrews Memorial Hospital will be used based on an agreement as an extension of the Kingston Public Hospital. So as needed, patients who are admitted at KPH would also, if necessary, and based on the appropriate arrangements, be housed at Andrews Hospital. So we have been able, therefore, to bring that synergy, which is important.
Dr. Tufton made the announcement during a digital press conference from the ministry's head office on Wednesday. Meanwhile, Permanent Secretary in the ministry, Dunstan Bryan, further explained that the agreement will enable KPH to treat more COVID-19 cases.
Plan that was agreed to with Andrews is that those medical and surgical patients who could be admitted to Andrews as an extension of their admission to KPH would be housed or would be accommodated in their facility.
The country's mobile testing mechanism will start rolling out today, April 3, as the Ministry of Health and Wellness ramps up testing for the novel coronavirus COVID-19. Portfolio Minister Dr. Christopher Tufton made the announcement during a digital press conference on Wednesday.
The ministry will be essentially engaging mobile units, which will be branded to indicate their purpose, and those units will be deployed in parishes across the country. We're going to begin in the Southeast Regional Health Authority, SERA, and Northeast Regional Health Authority region, and there will be a protocol assigned to the deployment of those mobile units where persons who have a desire to be tested would be subjected to that protocol in terms of an assessment done or triage, as would be done in an accident and emergency context. And if they meet the specific requirements or criteria, then the samples would be collected by those units and tests administered, and they'll be contacted and given appropriate counseling and guidance.
The public is reminded that they can go to the office of the Heart Foundation of Jamaica for heart screening and to keep a check on their heart health, especially in light of COVID-19. Persons who have heart disease and contract the virus are at a greater risk. The Heart Foundation of Jamaica is also offering its usual services, including blood pressure, diabetes, and cardiology tests. Advanced cardiac testing and cardiac consultations requires an appointment. For appointments and information, contact the Heart Foundation of Jamaica at the following numbers: 876-334-5444, 4998 or 876-929-3195 or 876-926-6492. The Ministry of Culture, Gender, Entertainment and Sport is giving support to vulnerable adolescent mothers during the COVID-19 pandemic. Minister of Culture, Gender, Entertainment and Sport, Olivia Grange, says about 500 adolescent mothers and expectant mothers have been affected by the temporary closure of the Women's Center of Jamaica Foundation locations across the island, in keeping with measures to prevent the spread of COVID-19. And help is on the way for farmers who are having challenges selling their produce amid the COVID-19 pandemic. An Agri-Linkages Exchange A.L.E.X platform will allow farmers across Jamaica to upload respective produce cultivated and allow for further purchase. The equipment to facilitate this platform was handed over by Tourism Minister Edmund Bartlett to Minister of State in the Ministry of Industry, Commerce, Agriculture and Fisheries Floyd Green during a digital press brief to provide an update on the tourism sector.
What we have recognized now is that the A.L.E.X, as we call it, is critical because people are unable to leave their homes to go to the regular markets and supermarkets. So what we have said to the team and what we've seen, Minister, is that we now have more orders of just individuals who are logging on to the platform, seeing that we have cucumber, that we have cantaloupe, melon, and making their orders. And what we find is that a lot of the farmers on the platforms will deliver themselves. So the A.L.E.X platform now is providing us an outlet for access to this excess produce. So I say to those who are listening, if you're wondering how can you get some of this excess produce that we have, go on agrilinkages.gov.jm. It used to be for big orders, but the platform is so configured that you can order even 2 pounds of tomato. What we find, the farmers who are willing to deliver, and a lot of them are taking those orders.
The Tourism Enhancement Fund provided the money, and the A.L.E.X platform is a bipartite agreement between the Ministry of Tourism through Tourism Linkages Network and the Ministry of Industry, Commerce, Agriculture and Fisheries through RADA. The private sector organization of Jamaica has launched a fund called PSOJ COVID-19 Jamaica Response Fund. The PSOJ says it will facilitate donations and contributions of cash towards meeting the needs of citizens and mitigating the threats associated with the COVID pandemic. The move comes on the heels of member companies of the PSOJ recently joining forces and contributing a total of $150 million to purchase ventilators to outfit hospitals that have been designated by the Ministry of Health and Wellness to handle persons infected with the virus. The Jamaican public and wider diaspora can also contribute using CVSS US dollar account at JMMB, account number 006 000-181-484. That's 006-000-181-484. The weekend is the busiest time in our markets for Jamaicans who want fresh produce. However, Minister of Local Government and Community Development Desmond McKenzie is reminding the public that while you shop all you want, practice social distancing at all times.
Saw some pictures coming out of downtown Kingston. Those are frightening scenes. In a time when we are asking people to keep a safe distance. And I can only use this medium to those who are listening to appeal for there has to be a special sense of purpose by our Jamaicans who use these facilities. Help us to help you. Because at the end of the day, we will not compromise the wider Jamaica to facilitate persons who are not prepared to toe the line.
He was speaking at a digital town hall meeting held by the ministry on March 31 to discuss operation of the nation's markets. Isolated, not alone. That is the message Prime Minister Andrew Holness delivered to seniors in his St. Andrew West Central constituency on Thursday. Last week, the government mandated that seniors stay home to reduce their risk of exposure to COVID-19. Mr. Holness delivered care packages including essential food items and sanitizers. In a post on social media, the Prime Minister stated, quote, "I also took the opportunity to assure our seniors that this stay-at-home order is for their own protection and that we are alone together," end quote. He urged citizens to continue practicing social distancing, stay at home, take the precautions outlined by the government, and take special care to ensure that our most vulnerable in our communities are looked out for and protected. At least 10 persons have been arrested for breaching the COVID-19 curfew, which started on Wednesday. The police say among the group is 37-year-old Dwayne Mitchell of Pencil Street, Kingston, who was seen in a viral social media video stating his refusal to comply with the order. The police say scores of persons were warned for prosecution and they cooperated. The cops are reminding the public that failure to comply may put others at risk of contracting the coronavirus and can result in actions taken against a non-compliant individual. The Independent Commission of Investigations, INDECOM, wants in on the list of agencies exempted under the new curfew order. The commission, headed by Terence Williams, is empowered under the INDECOM Act to provide independent oversight to activities of the security forces and its function to attend fatal and non-fatal shooting incidents. The Commission says it has written to the Minister of National Security seeking approval by Cabinet as an exempted service or activity under the order, but so far they have not had a favorable response. As businesses close to help prevent transmission of COVID-19, financial concerns and job losses are one of the first human impacts of the virus. Not knowing how this pandemic will play out also affects our economy, our physical well-being and mental well-being. Despite this fear, businesses and communities are being encouraged to have an altruistic response in the face of a crisis. Chief Investment Officer for Capital Solutions and serial entrepreneur Dina Hines has some advice on the opportunities fellow entrepreneurs can capitalize on at this time.
During this time, I'm sure there will be private equity investors who are looking for opportunities. So just like you have persons right now who are looking on the stock markets, both local and international, and saying, you know, these stocks they have sold off, they are a buy now, they're a good buy right now, right? You will see private equity investors looking on and saying, you know, this company is a good company, and I know a year out from now it should be do well. I'll step in and I'll invest in this company and help it, and you know, help it to get to the other side. And that's why I think that this is, even though there's a crisis, there's also opportunity. When you're at home, you're not as active as before. The things that you normally don't get to do because you're so busy in the company, start doing them. Start doing your business plans, start doing your projections, start doing your proposals to be able to go out to an investor. Because yes, the government is one avenue, but there's also the private equity flows that will no doubt be starting to come out and to look for opportunities over time.
We'll have more from this interview in our next newscast. Despite the COVID pandemic, the wheels keep turning in some quarters. It's still business as usual. Let's now join Denise Williams and Gabriel Thompson for the Business Report.
This is Denise Williams with the Business Report for PBCJ. On Wednesday, U.S.-based nonprofit business research group, the Conference Board, published an analysis of 3 potential scenarios explaining when the U.S. economy might recover, depending on when new coronavirus cases peak in the U.S. And this is very relevant for Jamaica and the Caribbean, as the U.S. is our largest trading partner. Now, the most optimistic scenario is called the May reboot, which is achievable if new U.S. coronavirus cases peak by mid-April, enabling widespread economic activity to resume in May. Now, here's how that would affect that U.S. economy. First, the economic side of the crisis would only last 6 weeks, leaving many industries relatively unscathed, although industries like entertainment, recreation, and transportation would still take large hits. Unemployment would rise to 8% by the third quarter, and overall consumer spending would decline 2.5% this year compared to 2019. Now, the report projects for the U.S. strong declines in investments, exports, inventories until the second half of the year in this May reboot scenario. Now, the second scenario, called the summertime V-shape, would likely occur if new U.S. coronavirus cases peak in May, leading to economic restart by July, which would then impact retail trade, wholesale trade, manufacturing, would join the list of the hardest hit industries. The economy would contract by a massive 35.6% during the second quarter, leading to an unemployment rate of 15% by the third quarter. Recovery, though, would be sharper. And this is the good news, because then there would be increased summer activity after the virus peaks. Now, the third scenario, which is the fall recovery, assumes that the U.S. successfully flattens the curve of new coronavirus cases and control the rise of new cases and ease the strain on the country's healthcare system. This would likely reduce the total number of fatalities, the report notes, and would be the hardest on the U.S. economy, as a reboot wouldn't be feasible until September. As a result of that, finance, insurance, and professional business services would join the list of hardest hit industries. Consumer spending would drop by 38% in the second quarter, only recovering by 18.5% in the fourth quarter. Investment and exports would follow similar patterns. The economy would contract by 6% this year compared to 2019, the largest such decline since 1946. By comparison, in 2009, the economy only shrunk 3% compared to the year prior. And a caveat, these numbers assume that the coronavirus won't return in full force during the fall. Now, in even the most optimistic projection, economic activity across the United States will be down this year. The latter two scenarios, that's the V-shaped recovery in July or the fall reboot in September, are the ones most likely, according to the conference board. Now, we in the Caribbean will more likely follow whatever trajectory the U.S. follows, because, as we all know, we're highly dependent on the U.S. for support, whether it's remittances or tourism. So knowing these tough scenarios doesn't make your job as a business person any easier. But it is easier to know what might be the case so that you can plan and you're not operating in the dark. This is Denise Williams for the Business Report on PBCJ.
In Thursday's trading session, the JSE Combined Index advanced by 3,429 points to close at under 400,000 units. Overall market activity resulted from trading in 79 stocks, of which 49 advanced, 18 declined, and 12 traded firm. The Junior Market Index advanced by 69 points to close at under 3,000 units. Stocks advanced for 1834 Investments, Berger Paints Jamaica, and Blue Park Group. Stocks declined for AMG Packaging and Paper, Barita Investments, and Caribbean Assurance Brokers. Trading firm were 138 Student Living, CAC 2009 9.5%, and Carreras Limited. Trans-Jamaican Highway Limited was the volume leader with 10.3 million units, followed by Mailpack Group Limited with 8.3 million units and Wigton Wind Farm Limited ordinary shares with 3.3 million units. Now for the foreign exchange. The US dollar on Thursday, April 2, ended trading at $136.43. The Canadian dollar sold for an average $96.90. The pound sterling traded for $170.67, and the euro ended trading at $151.30.
In regional news, Guyana has implemented new measures to fight the spread of COVID-19. President David Granger made the announcement on Thursday. InfoHub's Anara Khan has the details.
The government, in order to strengthen containment measures, will close public gathering at places of entertainment, including bars, clubs, gymnasiums, nightclubs, restaurants, and swimming pools, between the hours of 18 hours and 06 hours, that is to say, between 6 p.m. and 6 a.m., with effect from midnight, that is 23:59 hours, on Friday, 3rd of April 2020.
President David Granger. The head of state noted that there will soon be an announcement of additional restrictions designed to protect the well-being of the public. The president called for Guyanese to take decisive action by adhering to the advisories issued by both the Public Health Ministry and the National COVID-19 Task Force.
Guyanese, I iterate the need for all citizens in all parts of the country to adopt the many advisories that have been issued by the Ministry of Public Health and the National Task Force, including avoidance of leaving home, avoidance of gatherings of more than 5 persons, avoidance of visiting sick persons, avoidance of touching other persons, avoidance of touching parts of your own faces, and washing hands frequently and thoroughly in water.
President Granger also reminded Guyanese of some of the decisions taken thus far to help safeguard against the spread of COVID-19. These include, but are not limited to, the suspended operations of the Cheddi Jagan International Airport and the Eugene F. Correa International Airport, closure of seaports to international vessels, relaxation of VAT on medical supplies that are linked to COVID-19 testing, postponement of the National Grade 6 examinations, and closure to the University of Guyana campuses.
The Ministry of Public Health, together with the Civil Defense Commission, has been engaged in mobilizing medical staff and marshalling the resources and equipment needed to fight the disease.
More decisions stemming from the National COVID-19 Task Force are expected to be implemented shortly.
There are 4 new confirmed cases in Trinidad and Tobago, which now brings the total to 94. We get more in this TTT News report.
The Ministry of Health says a total of 638 samples have been sent to the Caribbean Public Health Agency for COVID-19 testing. Of the 4 additional persons having tested positive for COVID-19 since this morning, 2 were in contact with persons who tested positive for COVID-19. 1 has a history of recent travel, and the other confirmed case is still being investigated. To date, 5 COVID-19 patients have died, with 1 patient discharged. The Ministry of Health continues to remind members of the public to protect yourself by washing your hands often with soap and water, or by using an alcohol-based sanitizer that contains at least 60% alcohol if soap and water are not available. And remember to practice social distancing. Maintain at least 2 meters or approximately 6 feet distance between yourself and others, especially anyone who is coughing or showing signs of flu-like illness.
In sports, we kick off with football, as Reggae Girls goalkeeper Nicole McClure has become the first national player to confirm she tested positive for COVID-19. However, McClure, who is with her mother in the United States, says she has been fully recovered for close to 2 weeks. The 30-year-old played 2 penalty kicks in the CONCACAF final round qualifiers to help the Reggae Girls advance to last summer's FIFA Women's World Cup. McClure says her mother, who works in the health system, tested positive after feeling ill as well. McClure made her senior debut for Jamaica in 2009. And that's the news. On behalf of the production staff here at PBCJ, we urge you to keep safe, wash your hands often, and maintain social distancing.